Hello YouTube family, and welcome back to the channel. Today I want to cover veterinarian care. I am not a veterinarian, but I want to talk about, from a reptile keeper perspective, some things that I know based on experience have assisted me, or my veterinarian has taught me or recommended to me throughout the years. I will first like to say, just be mindful that every person who is a licensed veterinarian may not have adequate enough experience to assist you with some of your reptile needs, particularly when you come into certain type of animals. So some of the larger boys that some of us keep, or birds, for example. I kept birds earlier in my college years, and there's a lot about birds that's hard to treat from a veterinarian perspective unless you have a lot of experience. Very similar to our snakes. I'll use two examples. Administering medicine to birds or our reptiles is always tricky, especially anesthetics or anesthesia, because birds have a very high metabolism and reptiles have a very slow metabolism. And reptiles also have a slower healing process as well. So a lot of times when we go to our veterinarians, they don't have enough experience to know how much medicine to administer, or how much care does a actual injury or infection need. It's all of that, like all of those things come from practicing medicine, even with humans. Just so happens that humans have more common ailments, diseases, and infections that we have been worked on so much that there's enough case studies to know how to properly treat different people under different circumstances than we do have on record for our reptiles, for example. But I just wanted to share just a few things, a few tips that I have experienced and continue to use to this day if I need to. Fortunately enough, I haven't had many animals get sick of anything. The only animal that I ever had, I can't even say it was sick, it just died, and it was 22 years old, so I'm not sure what that was. Was it age, or was it something that was actually ailing the animal? But it didn't have any symptoms of ailments before she passed away. However, during COVID, it was like hell to get into doctor's offices for your animals. And at that particular time, I had the golden child cow, who was only probably about a year old at that particular point, who had broken a tooth and actually had gotten a abscess in the area where she had broken the tooth. I was able to identify what that was based on experience, but I didn't know what the hell to do. What I did know is that even in humans, an abscess can infect your body, give you sepsis, and kill you really fast. So I just needed to get into a vet in my head, right? So a lot of times I think we panic, not understanding the resilience of the animals. But great reptile keeping is always going to be surrounded by consulting someone. And so I want to share one of the first tips that was my first experience during COVID, and I didn't know what the hell we were going to do with this. But when I couldn't get into the doctor's office for 2 weeks, and clearly my baby had an abscess, and I gave the veterinarian all the information I can over the phone. Most vets, including my vet, who I have a really good relationship with, typically won't administer medicine without seeing the animal. But there are times, because of relationships you have built with your veterinarian, or just like with your personal doctor, they trust you to be able to give them the symptoms, and so that they can help you along the way until you can get into the office to kind of give yourself relief. I personally, as a human, hate toothache, so I was just thinking my animal is just going through her head, just aggravating pain, can't explain it to me. Her behaviors didn't change much. She still was very much active. She still ate, but I could not take the visual of looking into her gum and seeing an abscess there. So one of the things that was recommended to me, and something that if I ever had to experience it today, I would still use it, because this is a funny story I'm about to tell y'all. So this is a peroxyl mouth sore rinse, 1.5% hydrogen peroxide that we use as humans, right? If we were dealing with some type of soreness of the mouth or something like that. Oral sores, irritations, mouth burns. So what I did learn to do was temporarily, for a abscess or any other type of, I guess, it don't necessarily be an abscess, but mouth sore for your animals. Particularly, I'm talking about right now the animal I did do this with, not every animal that you own, because I cannot tell you that it works for every animal in that way. I can tell you that this worked for dogs, and it does work for a golden child cow, reticulated python, okay? So, took Q-tips daily, once in the morning, once in the evening, and 2 Q-tips. I would dip it into this top, pour about just, I mean, I'll say about half of this cap, or maybe to the rim of this cap, that's what it is, and add just like a 1, 2, 3, 4 drops of water, mix it up, take the Q-tips, stir it around in there, and then literally go into the reticulated python mouth and get under there to debride some of the abscess. And then after that, we would apply an oral gel. And literally, this is human medicine, technically. Oral gel, 4 times toothache, gum, and medicated pain relief medicine. But this also has a bacteria medication in here, so it helps prevent infection and kills harmful bacteria. So it keeps anything that's going on from getting worse until you can get to that vet. Now, I will put disclaimer out. This is something that I would say before you do to your animal, if you ever choose to use it, make sure that if you have a vet that you're discussing this with your vet. This is just something that worked for me, and my vet was dead on. So by the time we was able to get to the follow appointment, the abscess had actually, it was no longer visible. However, something that the vet shared to me is that an abscess never leaves. So he also administered antibiotic, and literally this was something that I didn't even have to shoot her. I would just literally use these droplets, put it in here, or this one, put it in here, pull it up, stick it into the reticulated mouth, right down the throat, push it, and the reticulated python swallow. I did that for about a week. There was no other further issues. Now, I want to point out what I just said, that the abscess was no longer visible, but the vet still administered the antibiotic because abscesses can lay dormant. And where there was not visible, it could be draining into the system, and that of course can cause some septic infection and kill your animal. So always consult with your vet. Something else that I have used throughout the years is, about a couple years ago, this Da Vinci boa. So, you know, the question was, does it work, does it work, does it work? So I can only give it to you based on my experience. So I never had a male animal come off food. I purchased one knowing that he was off food for 8 months. I really love the animal. The breeder was very honest. The breeder even said that normally the animal starts to eat again after 6 months. It was a recent breeder. But it didn't, so it was going on 8 months. I get the animal, another 3 months the animal didn't eat. So I said, I'm just gonna try Da Vinci boa for shits and giggles. So I know that some people say they have like a 70-75% rate. For me, I only use it on one animal for that reason. And I gave him, administered him 2 treatments or 2 servings of the Da Vinci boa, and immediately that animal started to eat again. So these are just 2 examples of items that I've used for my animals that I can tell you for sure absolutely work. Or let's say 3, because we'll count the oral gel as something by itself, but these two was kind of together, so I kind of wanted to. So I just wanted to share just some tips, because there's a lot of conversation. Sometimes as keepers, we get so emotional about our animals, and you know, we don't know if we can't get to this vet, if it's a panic to get to the next vet. The best thing is to call the person that you trust. I will also share that most veterinarians refer to herpetologists for their additional specialty, because the herpetologist, or you the keeper, who is technically, based on definition, a specialist in herping, based on definition, they'll reach out to keepers of a certain animal, because behaviors and after effects of medications, like how was the animal before and after, like all of that study and case study helps them to be able to better serve our animals further in the future. So never hesitate to contact a vet. Always keep in mind that the veterinarian that you call, although they are licensed veterinarians, and some of them specialists will even list that they're specialists with reptiles, they may not be a specialist with the specific reptile that you keep, and or bird, and or dog, or whatever the case may be. But specifically when it comes to reptiles, one of the things you should be always asking a veterinarian is how much experience they have with the actual reptile that you keep. I love the veterinarian that I'm using for my reptiles. It's totally different from the one I use for my dogs. That my dogs go to this vet for everything. They go to this vet for boarding. They go to this vet for medical. When my poor Howie passed away, that's who had him cremated. Like, they go to that vet for everything. But she is not a specialist in reptiles. Although she can work with a lot of reptiles, she is not a specialist in the reptiles that I keep, such as the reticulated pythons, ball pythons, Burmese pythons, boa constrictors, and etc. So she referred another veterinarian a few years ago who was, and even he will admit that when it comes to the reticulated pythons, he's very careful in administering them medicines, because he hasn't had enough experience with them to understand how their bodies will metabolize that. And then he used other resources as well when necessary, when it comes to different animals or reptiles that he doesn't have experience with. But he is very candid about the fact that most of the treatments that are given to reptiles, when vets do not have that specialty in that particular treatment and or medical practice, they will refer to herpetologists or people who actually keep those animals for their case studies. So hope this helps someone. I will live by this, because I will promise you that abscess was gone by the time we actually walked into the doctor's office. But again, the caveat is the doctor still administered, still a little bit in here, this medicine to kind of back up the treatment that I was already doing at home, and to make sure that there was no internal infection. Hope this video helps someone communicate with their veterinarian, or make decisions as to how urgent it is to get to a vet if you cannot get to your local vet, or if your local vet is not a specialist in the area of the animal that you keep. Peace.